this computer. Wow, thank you. Cool. So, Jess, do you want to lead us off?
Sure, absolutely. Well, it's pretty awesome we're all here today to basically introduce CANDOO Health, a new product that we've launched just in the middle of this year. And we're going to do this pretty informal. It's going to be more or less ask me anything. We're going to start out with us asking the question, the three presenters today, and then we're going to see if anybody has other questions in the meantime. So I'm going to do a little bit of an introduction on myself, and then we'll ask Gavin as well as Luke to introduce themselves. My name is Jess, Jessica Lunshof, and co-founder with Luke in CANDOO Health. I have a background in nursing. I'll get more into that in further into the webinar, but I have a background in nursing. I have an insurance background myself, and then also a what's last? So a business background. So yeah, we'll let Luke get into a little introduction, and then we'll leave it to you, Gavin.
Wonderful. So yes, Luke Watts. I'm also co-founder of CANDOO Health with Jess. My background is being involved in chronic disease management and delivery, including workplace wellness before. Very excited to be doing this project with Jess. Love what she's been doing in Canada, and having a background principally in the last 2.5 years, specifically supporting people with cancer. I think that we have actually got something incredibly critically needed. And I think it's an area that's very misunderstood in terms of its impact. And I guess during today, hopefully we'll be able to demonstrate what we can do and why it's so important.
Great, thanks. We'll leave it to you, Gavin, to introduce you. And
hi, everyone. I'm Gavin Mosley. I'm a group benefits advisor and specialist. I've been in the industry about 17 years now, sitting in most of the different seats you can sit in. So I've seen our industry from a lot of different angles, on the wholesale side, on the boutique brokerage side, on the global consulting house, and now sitting in my current seats as a local boutique benefits brokerage, but as well as running an insurtech platform where we help advisors get access to newer enterprise level programs that their small clients might not otherwise have access to on their own. So we're highly keen in finding answers to cancer. It's a problem that most employers struggle with and are fairly flat-footed in dealing with. So we're very happy to be here today and to be part of the discussion.
Wonderful.
Thanks, Gavin. And we also have Addison on the call. He'll do an introduction, and he will be moderating this webinar. Oh, but he's muted
there. But hello, everyone. My name's Addison Durhack. I work on the business development team for CANDOO Health, and again, as just mentioned, I'll be moderating this event. But very nice to meet you all.
Perfect. Yeah. So Addison, if you want to just start with the questions.
Okay, perfect. Yeah, I'll hop right in here. So I guess we'll start off with a little bit of a question for Jess to help kind of, give a little bit of an introduction to the product. So Jess, do you want to tell us just a little bit more about your history in healthcare and, why being, a caregiver led you to eventually, have the idea to build a health technology?
Absolutely. There is a story behind it, and it definitely has some passion and the reason why, and always like to understand why something is built. As I mentioned, I'm a nurse by trade, and I worked as a emerge nurse. I worked as a long-term care nurse. I worked as a home care nurse. I very quickly got out of working as a nurse based on what I experienced in the healthcare system, and that was 16 years ago. It's really dating me, but yeah, 16 years ago, I exited being a nurse on the floor because, quite frankly, the hospitals were full. They were full then. They're even more full now. We're seeing seniors passing away in hallways. It's just really tragic to see what is happening in Ontario in the provincial healthcare system. So I transitioned out of that and I ended up being a long-term care specialist with Sun Life Financial. So I ended up selling insurance for multiple insurance agents over Canada, basically. And so a huge need that, you know, when you don't have insurance, there's a lot of inconsistencies and inefficiencies that will, you know, not create a better healthcare experience, especially for seniors. So I did that for about 10 years and it was a real eye opener. I sat at, you know, dinner tables with family members and they're just throwing up their hands saying, I don't know what to do with my senior. I need money. There's not enough money to go around to take care of them if they live for 10 years with this disease. So that was my first introduction into insurance. And then I also did some of my own employee benefit providing while I was with Sun Life Financial. The big thing was actually in the midst of running a business and also being a full-time mom, I ended up becoming a caregiver for my mom and my grandma. And that's actually the reason why I built this technology, was because while I was working and being full-time mom, I ended up having to spend 80% of my time taking care of my mom and my grandma. And it was very taxing on myself, but I also saw that it was very inefficient the way that, it was run. There were so many different silos, so many different electronic health record systems. A lot of telephone was happening where people were constantly having to be informed of the same information over and over again. And to be honest, even in the last days of life, it was very difficult for, you know, my mom or my grandma or even me at this point when I'm so strained to repeat that story over and over again, their health history and so forth. So I came up with this idea that technology could help a lot of this. So the technology was built based on my experience of being a caregiver and what my family members had to go through while they were dealing with cancer. So that's how it all evolved.
Thank you. Perfect. Thank you for that, Jess. And then I guess this kind of leads into the next part. So how did you connect with the co-founder, Luke? And, what has come from that since?
Well, it was a great to meet Luke, but it was kind of depressing. So Luke lived in Thailand at that time. And it was one stormy, snowy night here. And we had a meeting and he had palm trees in the back and he was sweating profusely. And I was just like, I kind of want to be where you are, not here. But we started that relationship having some late night chats about, you know, our passions, our visions. And when you hear what Luke's built, it kind of really evolved into, he's got something great. I had something great. Let's kind of figure out how we can put it together and really tackle the market that, you know, is for, you know, the insurance world and the benefit providers, and really look at more of a health promotion and prevention concept, as opposed to what we found a lot is that people only are dealing with issues and when they're a crisis. Like, it could be caught a lot sooner that we take care of the problem than after the problems has already arose. So Luke and I connected and we basically decided we wanted to do a joint venture here in Canada. So when we talk more about the technology, that's how we integrated it.
Perfect. Yeah. So my next question is similar. Just how did you and Gavin meet, and how did you work together? And this is just before we kind of get into the crux of what CANDOO is.
Well, similar to how Luke and I met, I think Gavin and I met on LinkedIn, which is a great tool that I think everybody's utilizing quite well. We met, and then when we started talking about our history, you know, in insurance and kind of our different ideas, and when I saw what Gavin was doing with some of the packages he was putting together, it was kind of a really good fit. Like, he gets it. He's seeing what needs to be done in the insurance world and the benefit provider world. So that connection was pretty clear right off the bat that we could have a good strategic partnership.
Perfect. Yeah. And then Jess, my last question for you is, now that we've learned a little bit more about the kind of background and creation story for it, But what is CANDOO, and how can it be added to benefit and insurance plans?
Absolutely. So CANDOO is basically a technology. So it is a web-based platform that you could add to a benefit plan to really see value and show the value to the employees, and basically have that health promotion and prevention concept embedded into a package. What we have done here is we took a technology that I built here in Canada, and also what Luke built as well, which is called the Cancer Coach. So we took those two technologies and we integrated them, and we basically put them together to create this robust product that was really focused on providing the employees the best value. So CANDOO is built off 5 pillars of health. So the employee has access to these 5 pillars, and one is the journal. That basically is kind of like a chronological journal of information that the family members, other professionals can keep. So during a health event, or even before a health event, you can start keeping track of your information all in one location. There's a health profile. So you fill out this health profile once, and you will always be able to access that no matter where you are. And you can actually send that very seamlessly to professionals as well as other family members. So you have access to it in an emergency situation. The data trust, or my documents. How many times do we have electronic health records all over the place? Well, you can actually bring them all into one secure location, and you can share them seamlessly with people as well. And lastly is lastly is my team. My team is where you build out your team, and that could be involve a total of family members or health professionals as well. And then where Luke brings in such of the value is there's thousands of hours of cancer content. So we really wanted to focus on prevention. So prevention of cancer. We wanted to focus on if you get diagnosed with cancer. We wanted to focus on how to get you back to the workplace if you're diagnosed with cancer, as well as the big one is the caregivers, like how many people are caring for somebody that has a loved one dealing with cancer. A lot of the questions we get asked as well is this just for cancer? Well, we're focusing on cancer to start, but then we are going to branch out to other chronic diseases as well. You can utilize the technology for any disease or even non-disease, but the content is focused on cancer, but we will be building out content on other diseases in the future. And also access to cancer coaches, and Luke's going to get into more of that, as well as nurses and IT support in managing a healthcare crisis. So all encompassing, that is what CANDOO is, first version, and we're going to be rolling out more versions down the road.
Perfect. Thank you, Jess. And my next question is actually going to be for Luke. So Luke, do you mind just telling us a little bit about the impacts of cancer in the workplace and how it affects different employees?
Absolutely. And Jess gave me a great segue in there by raising the awareness of caregivers, which I'll talk about in a moment. But generally speaking, in any large workforce, in a per annum basis, you're talking about 3 to 5% of that workforce likely to be going through an active cancer treatment, which is quite a large percentage when you start thinking about larger workforces. And I guess the other thing to kind of bear in mind is that we know now that around 50% of all new cancer diagnoses are of people of working age. So the idea that you are someone who's retired or leading into retirement and therefore then have a very different attitude towards your recovery. You're talking about women in their 30s, you're talking about men in their 40s. And overall, the population has suggested 93% of them do actually want to come back to work. It's one of the main motivators and drivers for people to get well and stay well. So how does that impact the workplace? Well, massively. If you're talking about a population of those kind of numbers that are likely to have a cancer diagnosis, and I think Gavin used a great phrase, I haven't used it yet, but I will steal it, flat-footed. It is, I think that's a really good expression, is that a lot of companies are flat-footed when it comes to being prepared for it. Now, we could train HR people to be prepared for it, or we could give HR and large organizations a turnkey solution. And I think we've gone with the turnkey solution. So, when somebody has got that terrible news, that the CANDOO Health is the place where these people can actively outsource from the moment they get the diagnosis through treatment back into integration into workplace. It is a one-stop shop for all of those needs. There's also a big preventative part. And I love preventative medicine. I wish we could do more, but human beings tend to not do anything until they actually get sick. But we do have a big, preventative aspect to the resources as well, which hopefully I'll get a chance to talk about. But specifically to Addison's question, it is big. It is probably a little bit misunderstood. It is a big thing to deal with. HR companies or HR managers are not necessarily best equipped if somebody knocks on their door and says, I've got a cancer diagnosis. So the fact that a company could, at very minimal cost, give them access to resources and professionals who have been doing this for a very, very long time, who have the passion, as Jessica was saying, to really work with these people, we think it's a bit of a no-brainer, and it should be added to any benefit providers sort of portfolio. I hope that answers that.
Perfect. Yeah, and then just the second question I have is, what challenges are organizations facing?
So I think we kind of sort of touched on that a little bit and saying the flat-footed phrase that Gavin used earlier. I mean, there is legal precedence as well. Let us not forget that discrimination in the workplace is a very hot topic in Canada, and you cannot discriminate for somebody who has a cancer diagnosis. So if you can't discriminate, not that we should, you should absolutely provide the best environment to nurture this person through so they can be reintegrated back into work. And I think that discrimination law is going to apply to caregivers as well. If it already doesn't, it will be challenged. For every one person who has an active cancer diagnosis who may be able to take time off work, it is highly, highly likely that there's going to be 2 to 3 direct family members or friends that are going to be supporting that person who won't be able to take time off work. And these people present, in industry words, this thing called presenteeism. So being actually at work, but clearly can't function, which is completely understandable. So again, there's a legal precedence that is going to help and support this community. So again, flat-footed, you've got to get ahead of the curve. And we believe we've actually got that product that is a very simple turnkey solution with experts to provide that. And then I kind of mentioned it earlier, is the other one is the HR element. Putting that pressure on people to actually have to deal with employees and colleagues who have an active cancer diagnosis is not really, it's probably a little bit too much for them to handle. So again, to be able to outsource that to somebody like us, I think is going to be a significant benefit. And, cancer was it 1 in 2 women, 1 in 3 men? Whatever your position on COVID is your position, but it pales into significance when you think about the impact of cancer.
Perfect. Okay, thank you very much. And Jess, in my last question to her, touched on, CANDOO from a high level, but, in terms of the cancer resources, what products does CANDOO Health have to offer?
Sorry, to me or to Jess?
Oh, to you, Luke, sorry.
Oh, no, it's okay. It's okay. So essentially, there's 2 products. And we've got, so the Cancer Coach, which is the business that Jessica was referring to, that I own. The Cancer Coach is one-to-one personalized support for people with cancer. So this is direct relationship between a health coach who is qualified and legally has the professional indemnity insurance. They work with individual people to guide them through the entire cancer journey by looking at how lifestyle and lifestyle interventions evidence-based lifestyle interventions can be implemented in their everyday work. So this, we were talking about the impact of diet and nutrition, exercise and movement, emotional well-being, quality sleep, gut health, environmental toxins. So our product is a very personalized one-to-one, one coach to one individual. And we have put that across to the CANDOO model as our first product, which is kind of, we call the on-claim model. So in the event that somebody has an active cancer diagnosis, they can go to their organization, and they can be immediately connected to a qualified cancer coach who can then do one-to-one personalized cancer support. So that is a product that is literally being copied, paste, and put together for the Canada environment. The second product is one which is access to resources. So this allows for thousands and tens of thousands of people to have access to. And this is just very, very high quality content that we have personally created specifically for people that are wanting an anti-cancer lifestyle, starting at prevention, going through diagnosis and treatment, into recovery, and to support caregivers. So this is a 12,000 hours of content that we boil down into these silos of prevention, diagnosis and treatment, reintegration into the workplace, and for caregivers. And it's an amazing, I mean, this is the new one. This is the product that we brought together with Jess for CANDOO, which was, we can't give everybody access to a cancer coach. So how can we provide access to high quality education at a fraction of the price, of course, but to give them access to this information when they need it. So I think someone's raised their hand. Tanya, you had a question?
Yes, I do.
You're
so
welcome.
the cancer coach, is that for the employee if they're diagnosed with cancer, or can that be for a spouse or a child or something like that?
It's a really, really good question. It can be for either.
Okay.
And what I can explain by that is that I would say about half of the people that work with us at the Cancer Coach are actually looking after somebody with cancer. So they are the ones that are probably getting the information and then distilling it to the person at home. So perhaps it's more of an elderly relative, but it's son or daughter who might be the caregiver going, I want to know how to help mum through she's fatigued, she's not eating well, her appetite is suppressed, emotionally she's all over the place. The common side effects and complications that you get of going through a treatment program. So really good question. And probably about 50-50 it's split. The only, I'll just to kind of complete that circle, we won't look after anybody under the age of 16 directly. So that's the only condition that we have, is nobody under the age of 16. So, but apart from that, everybody, any cancer, any stage, are suitable to do this program. Thank you. Cool. So I think I answered what you asked, and Addison, two bits: on claim model, and then you've got access to the resources. Yeah.
Yep.
And then if you do get access to the resources, you can upgrade, for want of a better phrase, and get the cancer coach if you want it at a later date. So Corey, you've got your hand raised.
I'm just curious to know, what is the reason for the not working with anyone under 16?
Really good question. I think cancer coaching works best when both parties are committed to an outcome. And we've just found that younger people, they're just not as compliant, for want of a better phrase. They're not in that stage of contemplation of change. So cancer coaching is not just about giving the information, it's about applying the information in that person's environment and hoping to build sustainable long-term habit change. It's behavior change modification as much as it is about giving the right information. And when we deal directly one-to-one with somebody under the age of 16, we've just found that we've not been able to have the impact that we would hope to have. We have worked with mum and dad who is looking after somebody who's younger. That's absolutely fine, but I'm saying it's a direct relationship. It's just probably not the right balance. We just don't align.
Understand. Okay. No, that answers my question.
But to support that, Corey, as well, the technology, would be the parents using it and managing the health history, the health information of the kid on their site. So it could still be used for kids, just not, as Luke said, direct to the children.
Cool.
Perfect. Okay. So yeah, no, thank you, Luke, for answering the question. And I guess my next question's going to be geared towards Gavin. So now that we've heard a little bit about the product, do you want to tell us a little bit more about your executive product and how do you bundle CANDOO Health in with it?
Absolutely. Yeah. You know, especially when Jessica and I first started collaborating, talking about her program and where she sees it fitting in the benefits world. You know, when you think about insurance in general, insurance is great to have there for when you need a bag of money, but it doesn't provide the care, right? So we use insurance to access bags of money, but we need to look to the wellness world to make sure that there's services, there's humans, there's people other than claim adjudicators and, you know, receiving checks in the mail involved when somebody is literally going through the worst potential, you know, health crisis they've ever gone into. And, you know, having been in the industry as long as I have at all the different levels, you know, especially with boots on the ground, you know, it's one thing for somebody at the, you know, 50th floor of an insurance company head office to talk about somebody on disability because of cancer, but it's different when you're talking to them, and it's different when they don't know what to do and they don't, you know, they're and the waiting that is usually accompanying the start to treatment, the delays, and in the insurance world, every day of a delay is more claims being paid. So when we're delayed to see a specialist, when we're delayed to get a screening now, you know, COVID has really exacerbated this whole issue. I went to an industry education session last week and they flashed a slide that said the backlog for breast cancer surgery, you know, that's now 46-day backlog since COVID started, right? And, you know, when we look at some of our disability claims data, you know, it's funny when we looked at a report from one provider on their benchmarking, you know, the number of cancer claims that came in was around 13% near the end of 2020, and 2021 it went down to 11. You know, went from 13 to 11. I said, last time I checked, the number of people getting cancer wasn't going down, but in this case, it's the number of cases being caught, and sure enough, we saw it's starting to come back up because people couldn't get in. And so this backlog has, I mean, I know I'm preaching to the choir here, but it doesn't take far to look to know that our healthcare system is bursting at the seams. And we, for the first time in Canada, we found insurance that people can buy. I mean, whether you're for or against a two-tier system in Canada, I mean, it's here. It's been here actually a little while. You may not have known about it. Doesn't always hit the front page of news, but private clinics have existed here for a very long time. But up until now, there hasn't really been that bag of money, that insurance product where people can take more control over their healthcare and purchase it and get in control of how, if they don't want to be stuck with these delays, if they want their health outcomes to really be in the control of however long the line happens to be that month or year, where we're giving people more control through this program. So we've just launched it now through our group benefits InsurTech platform. It's available to all the advisors that work with us. It covers $1 million of insurance if you'd like to go get treatment outside of Canada, which we like that because we don't like necessarily skipping the line to get in front of somebody, a fellow Canadian, but we like the idea of getting out of the line and making the Canadian line shorter. And so with our product, it would enable someone to get treatment right away. And with what comes with that, though, is now having to retell your story to a new clinic or practitioner or specialist, and provide your health history again to a new practitioner and specialist. And that is exhausting. Working in the insurance industry, we love our paperwork. And when we're helping someone through the worst diagnosis of their life, the last thing they want to do is retell this story over and over and over. So the CANDOO Secure Medical Storage was really the perfect partner for us when we're helping someone navigate. But this insurance product is a bag of money. It's not the person and even if someone chooses to continue in the provincial coverage and say, yeah, I'm going to get treated here. I don't want to go to the Mayo Clinic in the US. I want to get treated here. The bag of money's there, but it didn't have the person to guide them along. It didn't have that helping hand to help them coordinate appointments and really set the stage of what they're in store for the next few months or few years, and what they can expect. And anything that we want to get people off of Google, and trying to find information. So, having them in a clinically driven, evidence-based environment to get good information from people with clinical backgrounds is really important to how we want to service our clients. So really, with the combination of insurance, which can now better support people who want to get quick access to cancer treatment, there's that gap there that CANDOO on the coaching and the medical record storage side was really a perfect fit for how we want our customers to feel and then felt taken care of in working with advisors in our ecosystem.
Perfect. Yeah, thank you. Thank you for that, Gavin. I just have one quick question before we open up the floor here. So, I mean, given the existing environment within the industry, do you feel that brokers / insurance providers have to be more innovative, and just have a stronger focus in on health promotion just to stay ahead in the market?
Absolutely. The insurance industry is highly commoditized, race to the bottom with rates. However, if we're putting people through a meat grinder to make a claim, especially for something as complicated as disability, it's, I would argue, does that program really work? Right. And companies today, call it what you will, the Great Resignation's on, this is the big buzz term now. And a lot of companies are really culture forward in how they're advertising jobs and how they take care of mental health and wellness within their cultures, and being diverse and equitable and inclusive, and how they operate as an organization, which is great. But if you just have a bag of money sitting there, a company with a 20-page form to really take care of people when they're at their worst, does that really align with the culture they talk about in their job postings? Right. So it really, for a company that really wants to be forward in how their employees are treated and taken care of, you can't just have insurance anymore. You really need to build a bigger plate with wellness and care tied in. And, every disability report we look at, mental health claims are on the rise, cancer claims are on the rise. These aren't going away. And as benefit advisors, we're in the hot seat. How do we get these claims down? How do we save money? Prices are going up. This is how, getting in front of the claims, getting people back to work faster, getting treatment faster. That's how. Just waiting for the claims to come in and sending them off to deal with an adjudicator saying yes or no, and say good luck with that help system. Hope that works out. We'll see when you get back. That to me isn't really a benefit strategy that is going to work for more progressive companies in the future, especially those with remote or dispersed workforces, where it's tougher to build culture when you're on screens and working with each other from afar. So a program like this can really bring an HR department closer to the people that they're in charge with taking care of.
Perfect. Yeah, thank you. Thank you very much. So I guess that's the end here of the questions that we have structured. So I'd like to take this time to open the floor up to, I guess, anyone here to ask any questions, either about the product, trends that, we might be seeing in the industry, as well as, how you could potentially, I guess, go about bundling this product within your benefit plans. Is there any questions?
I have a question for you. And maybe you can, I'm sure you're very familiar with all your security protocols that you have in place for all of this information and where it's stored. And I think in this digital age, that is probably the biggest concern of people filling in information online is I'm going to put in all of my personal information, all of my medications, all of my health records, and where is it going to go?
Mm-hmm. That's an excellent question. It often comes up, and that's why we also looked at how secure we can make it. And nothing can be absolutely 100% secure, but we have taken the utmost importance to getting it as secure as we can. So here in Canada, we have to be HIPAA and PHIPAA compliant. So what we did was we partnered with a company called MedStack, and they're out of Toronto. They meet all the requirements. So our data is actually housed in a cloud with them, and they keep it well protected. But then we took it to the next level. We actually integrated the technology with BlackBerry Spark. So even when you transfer documents back and forth, it's very secure and encrypted as well. We've done full privacy impact assessments. We've done a threat risk assessment. We're actually integrating into hospital systems, so we've had to be very compliant. So we've check marked most of those boxes.
Great, thank you very much.
Well, I guess if there's no other questions, I'll thank everybody for joining us today. Luke, thank you for your input. It was great. Gavin, really thank you, because you're living, breathing it every single day in the insurance world, and it was great to have you on and to being our promoter as well. And we hope we can grow together in the strategic partnership and look for other partnerships with other brokers and advisors or benefit providers that would like to be more promotion and health prevention as opposed to just giving money, frankly.
Amen. And we appreciate, we love being first. I mean, that's part of what we do within our InsurTech platform. We vet not only the programs, but the people. And I'll say people with a capital P. And the program is good, but the people are better in your organization. And when we see a program as robust as this and unique, why would I ever want a client having to go through a diagnosis without it, right? So, we're starting with our executive product, but as you expand your services, as you complete your integrations, as we grow economies of scale together, I want this on every customer that we ever work with, because knowing that you exist. We don't want someone to be left out on their own to deal with like OHIP and having to navigate on their own. So no, it's wonderful to have you as a wonderful new arrow in our own quiver, which definitely helps us enhance our value proposition and working with our clients. So thank you.
Awesome. Well, that was a great sum up. Thanks so much, Gavin. And thank you everybody for joining us, and have a good rest of your day.
Thank you. Bye, everyone.
Goodbye, everybody. Thank you.